chapter we're going to see is development. Okay, fine. So development is another important chapter in pediatrics. So growth, I told you the important aspects of growth, why it is important. Now, what is development? What is development? What is the definition of development? Growth, I told you, it is increase in size of cells. But what is development actually? Can we use the term synonymously, or growth is different, development is different? Different, yes, very good difference. See, growth is increase in size of cells. Development is the functional maturity. How mature the organs are, how mature, that is the development. Yes, very good. It is the functional maturity. So please write, definition of development is the functional maturity. So you would have known a newborn baby. Okay, there's a baby who is born. So what will a newborn baby do? If the baby wants something, the baby will cry. Just lie down in the same place, right? But what about a 1-year-old baby? A 1-year-old baby can actually stand without support and try to walk. What is happening in this 1 year? A baby who was totally accustomed to bed is now starting to walk after 1 year. What is happening? How did this happen? This is called as development. So that is what we are going to see in development. So you would have studied the domains of development, gross motor, fine motor, when the baby started to speak, when the baby started to crawl, walk and all, right? So many things you would have studied. So how many of you think learning development is easy? How many of you think it is easy? Okay, I know everything about development. This is just going to be a revision class. Yes, with mnemonics, okay. But I'm not a big fan of mnemonics, because when I keep mnemonic, to remember that mnemonic, I have to keep another mnemonic. What about others? Very volatile, yes. So generally when it comes to development, you people think, oh, it is very difficult. You have to mug up. Either you go with mnemonics or you go with mug up, right? That is the only type of studying you do with development. I was also the same. When I was doing my UG, so I will try to mug up development. But at the end of the day, for the exam, I will remember. But later, what will happen? Again, I will tend to forget. I again and again, you have to go and revisit development. But what if I tell you there's an easy way of learning development, which I learned only after getting into post-graduation. So once I got into post-graduation, pediatrics, everything is about development, right? So I was the non-service PG. So non-service PG, you all know. So I had a colleague who is a service PG. So I was fresh from my internship and preparation. So I was able to answer all the complicated syndromes, genetics, everything, whatever they asked, I will be able to answer. But whenever it comes to development, I will struggle. Even if the smallest, easiest things, I will not remember with development, because I don't have this mug up memory at all. So that is a very short term memory, it will go off. But my other colleague who's a service PG, she'll be very strong in development. Whatever the chief asked, she'll be able to answer. So I went and asked her, Epdi ma'am, development mattum nalla theriyudha, how is it possible? I asked her. So what she told was, she actually had a 3-year-old daughter at that time. So she told, see, I am learning development because I'm seeing development in front of my eyes. So what I asked, like, how can I do? Because I was not married at that time. And she told, better get married and get a child so that you can also learn development. So what I'm trying to say is, I'm not trying to say that for you to learn development, you should have a child. But when you have a child in front of your eyes, it is very easy to learn development. Right now, I have a 3-year-old daughter. So right now, it's very easy to relate development and study. So the way you study development is totally different. You should never mug up development. You should never try to keep mnemonics and study development. So very easy way of studying development or learning development is seeing it in front of your eyes. Where to see it? Resources are there everywhere. Wherever you go, you will see a child. So learn from them, observe them. It is very easy if you have your own child, or if you have a niece or nephew at home, very, very easy. The problem is solved. Okay. So after this class, try learning development in a different way. You will definitely not forget development. You will definitely not need to mug up development. So what I'm going to do, I'm going to try to ease it as much as possible so that you will not forget development. Okay, so when we go inside development, the first thing I want you to understand is the laws of development. Okay, the first law of development is a continuous process, and it is cephalocaudal in direction. Cephalocaudal in direction. So what do you mean by cephalocaudal? Head to foot. So whenever development happens, it starts with head, trunk and foot. Example, only after neck control, the baby will sit. Only after sitting, the baby will walk. So cephalocaudal. The next one is It is proximal to distal. So proximal muscles will develop first, followed by distal muscles. Example, when you show something to a 4-month-old child, the baby will try to reach the object like this. So proximal muscles will act. Whereas a 1-year-old child will be using the distal muscles. So proximal to distal. So cephalocaudal, proximal to distal. Okay. The next thing is rate is different, but sequence is same. So continuous process also you write it here. Okay. Rate is different, but sequence is same. What do you mean by this? Rate is different means one child can walk at 1 year. Another child can walk at 13 months. Another child can walk at 15 months. You can't say 1 year, all of you should walk. It is a range. It is always a range. So rate can be different, but sequence is same. As I told you, head control, sitting, walking, and then only running. This is the sequence. Be it a child from America or South Africa or India, the sequence will not change, but the rate can be different. Okay. Next. Mass movements are converted into organized movements. Same example. So initially the baby was trying to reach for an object like this. When it becomes organized, it will use the distal muscle to reach. That is called as mass movements are converted to organized movements. The last point is primitive reflexes will be replaced by definitive milestone. What do you mean by this? What are the primitive reflexes? Yes, what are the primitive reflexes? Name one primitive reflex you know. Neonatal reflexes. You would have heard in CNS examination in newborn. Very good. Moro reflex, ATNR. Okay, two reflexes I will take. What is the meaning of this? Moro reflex. How do you do Moro reflex? Yes, this is how you hold the baby. You will suddenly drop the baby and hold it. The baby will have a response. Right? That is Moro reflex. See, suppose the baby's head control is there. Will you be able to see Moro reflex? When you are letting the baby down, will the baby's head go down when there is a neck holding? Yes. No, right. When the baby, if you're going to let the baby down, the baby's neck will be stiff. So the baby will not go down and the reflex will not happen. So when Moro reflex disappears, neck control is achieved. So 5 months of age, around 3 to 5 months of age, Moro disappears. Around 3 to 5 months, Moro, your head control is achieved. That is the first thing. Second, come to ATNR, asymmetric tonic neck reflex. So what is asymmetric tonic neck reflex? If I turn the neck to one side, my upper limb and lower limb on that side will extend. See, I'm turning like this. This side is extending. Will I be able to roll over if this happens? No, right? So the baby wants to roll over, baby turns, immediately this is extending. So by 5 months of age, ATNR will disappear and the baby will start to roll over. That is the meaning of this last sentence. Primitive reflexes are replaced by definitive milestones. Able to understand? So these laws, no one will ask you the laws. But for you to understand development, these laws are important. Okay. Now, coming to the domains of development. What are the domains of development? Gross motor, fine motor, social and adaptive, language, two other things. These four everyone knows. Two other things. Vision and hearing is also important. Okay. See, gross motor, gross activities, sitting, running, walking, jumping, all this is gross. Fine motor, fine activities, how the baby is holding a pen, when the baby starts writing, scribbling, that is fine motor. Social and adaptive, how you interact with the society. Language, how the baby starts speaking. Vision and hearing, you all know. These are the heading under which we are going to learn development. Clear? Okay, so can we go into each and every domains? The first domain we are going to see is the gross motor development. I told you, right? I will try to make it as simple as possible. So this is The same baby whose photographs have been given starting from birth till 1 year of age. So we are going to see this baby's development from birth till 1 year of age. So this baby's name is Liana. So Liana is going to help us in learning development. Okay. Okay. So gross motor. So look at the first image. What is the baby doing? How is the baby's neck? Yeah, that is my kid. Yes. So that is my kid. So the pediatrician in me doesn't want to lose the milestone. So what I did was I took serial images of the milestone and I'm using it for the classes as well. Yeah. Okay. So first image, what is happening? How is the neck of the baby? See, all of you would have held a newborn, right? So in your home, your niece or your nephew, or if you hold a newborn, what will the elders in our house say when you want to lift a newborn? What will they say? Yes. Paathu, paathu, tala paathu. Yes, hold the neck. Okay, because you have to support the neck. Why? Because don't drop. Okay. So hold the neck is something they say very common, right? Because the neck of the baby is not supported at birth. You don't have neck control. When will they have neck control? 3 months of age is when they will have neck control. So see there, the baby, you can see the baby is lifting the neck, lifting the head. So this is neck control, which is achieved by 3 months. Okay, the next image, what is the baby doing? What is the baby doing? Yes, rolling over. So rolling over comes by 5 months. Rolls over by 5 months. Okay. So here, the rolling over, you will have it like from supine to prone, from back to front and all. So you don't have to remember in detail. Just remember, rolling over is around 5 months. Okay. Next image, look at the next image. How is the baby sitting? How is the baby sitting? Tripod position. This is like a tripod. Okay. So this is sitting with support by 6 months. So 6 months, the baby sits with support. So yes, yes, yes. Remember like this. Sits with support at 6 months. This is called as tripod position. Okay. So after sitting with support, what the baby should do? Sit without support. This comes around 8 months. So next image, can you see the baby sits without support? Okay. 8 months. Clear? Okay. Come down. What is the baby doing now? Now the baby was sitting without support, is standing, but standing with support, holding on and standing with support. When does it occur standing with support? 9 months. 9 months, the baby will be able to stand with support. What is the next image? The baby is holding on to furniture and trying to walk. Can you see? Baby is holding on to furniture and trying to walk. That is called as cruising. That is called as cruising. So cruising occurs somewhere around 11 months of age. 11 months of age. Okay. Look at the next two images. Both the images, the baby is trying to move. In the first image, you can see the abdomen is touching the ground. In the second image, you can see the abdomen is not touching the ground. What is the first image? Creeping. What is the second image? Yes. One is creeping, one is crawling. Which one is creeping? First one is creeping. Huh? See, very common confusion we have. Please remember, how many of you here play PUBG? PUBG. If you want to hide and go, how will you do? So your abdomen will be touching the ground and you will keep moving, right? This is the same way how commandos grow. Some commandos, how do they move? They will lie flat on the floor and then they will move. So there the abdomen is touching. So what do commandos do? Commandos crawl. They do not creep. So what is the first image? The first image is crawling. Okay, when your abdomen is touching the ground, it is called as crawling. Crawling comes first around 8 months of life. Okay, look at the second image where the baby's abdomen is not touching the ground. Okay, how many of you have seen this song, Vasigara? Those of you who know Tamil would have seen this song. But I don't know. You people are 2K kids. I don't know whether you people have seen that song. Yes? Put a thumbs up if you know that song. Yes, okay. So in that song, Rima Sen will be doing one movement, right? So that movement is creeping. That movement is called as creeping. So creeping comes when? Creeping comes around 11 months. Clear? So first the baby will crawl and then the baby will creep. Crawling is touching the ground. Creeping is not touching the ground. 8 months and 11 months. Now where is our baby? Somewhere around 11 months. So the baby was able to stand with support around 9 months. What is the baby doing now? Baby is standing without support. When? 1 year, the baby can stand without support. See, just imagine you would have seen so many first birthday videos. So now there is a trend. You take video and photo shoot for everything. Maternity photo shoot, newborn photo shoot, every month milestone photo shoot, 1 year birthday photo shoot. So what will the baby do at 1 year birthday photo shoot? If you see those videos and photos, the baby will not do anything. The baby will be able to stand without support. It will try to walk, but it will not walk. It will just sit down. That is the maximum activity the baby will do at 1 year. So 1 year, what do they do? Stand without support. Okay. So now till 1 year, are you clear? Neck control, rolling over, sitting with support, without support, standing with support, crawling and creeping, standing without support. Everything with an interval of 2 months. Now what happens after 1 year? Now our baby is standing. What the baby should do next? Once the baby stands, what the baby should do next? Yes, baby should start walking. Around 15 months, the baby walks independently. After walking, what the baby should do? Running. Around 18 months, the baby runs. Okay. After running, what the baby should do? It should start climbing stairs. Start climbing stairs. 2 feet per step. Up and down. See, when you want to climb stairs, you will just climb the stairs like this and go. But when a 2-year-old baby wants to climb, it will climb like this. 1 step, another step. 1 feet, another feet. 1 feet, another feet. And down also same. 1 feet, another feet. 1 feet, another feet. This is called as climbing up and down 2 feet per step. How to remember? 2 at 2 years. 2 at 2 years. 3 years, what happens? Climbs upstairs, alternate feet, but downstairs 2 feet. Okay, now upstairs it can go alternate feet. 1 feet, 1 feet, 1 feet. But when it wants to climb down, 1, 2 feet, 2 feet. That is 3 years. Okay, 4 years. Both up and down, alternate feet. Alternate feet, both up and down. Okay, so climbing up also alternate feet, the baby will go. Climbing down also alternate feet. That is 4 years. 2, 3, 4. Okay. Now 3 years, just remember it will ride a tricycle. 4 years, the baby will be able to hop. 5 years, the baby will be able to skip. How to remember all this? 3, tricycle. 4, hops is a 4-letter word. 5, skips is a 5-letter word. Clear? Okay, fine. Yes. So this is about the gross motor. Okay. 2, 3, 4, 5. Please remember 2, 3, 2 feet per step. 3, alternate feet up while coming down, 2 feet down. 4, alternate feet up and down. 4 years hops, 5 years skips. Okay. 2 other important milestones I want to say. One is called as pivoting and the next one is called as casting. What is pivoting? Where have you heard this word? Pivot, pivot. Those who watch series can relate. Pivot. Friends, yes, very good. Friends. So, Friends is a series, very wonderful series. When you feel bored, you can just go and watch. When you feel depressed, when you feel so much stressed, also you can watch that series. Yes, there you have a scene where pivot. So, what happens? So, pivoting is something like when you sit here and you turn like this. So, the baby will be sitting here, will turn like this and take the object. That is pivoting. Casting is throwing things. So, for a 1-year-old baby, if you give something, the baby will throw it. So the baby is not arrogant. The baby is actually normally developing. It's a normal development. Throwing things is called as casting. So pivoting and casting comes by same 1 year. Okay, same 1 year. Yes. So this is about the gross motor milestones. Okay, fine. Any doubts in gross motor? I think it's pretty clear now, right? Okay. Next, we'll go on to the fine motor milestones. So fine motor milestones, the first milestone is bidextrous reach. Bidextrous, you show something to a baby, the baby will use both the hands to reach. That is called as bidextrous reach, which comes around 4 months of life. Unidextrous reach, using only one hand to reach is called as unidextrous reach, 6 months. Okay. Next. So if I ask you to take an object, suppose I keep this pen here and if I ask you to take, how will you take it? You will take it like this, right? You will use your index and thumb finger and take it. This is called as pincer grasp. But pincer grasp comes only by 1 year. Before that, if you ask a baby to take something, this is how the baby will take an object using the radial aspect. Using the radial aspect. This is called as radial grasp. And you have another milestone called as immature pincer, where the baby will use the thumb and index finger, the whole thumb and index finger to lift an object. Okay, both these milestones will come under 9 months. Okay, look at the next image. See, beautifully the baby is holding an object with the thumb and index finger. That is called as mature pincer grasp. Mature pincer grasp, which comes around 12 months. Comes around 12 months. Okay, now the baby has started to take an object. What the baby has to do next? Baby has to start drawing. So just, this is already given with you. So you just have to observe and see. Initially, the baby scribbles. After scribbling, the baby draws a vertical stroke. After drawing a vertical stroke, baby draws a circle. Then cross. Then rectangle. And then triangle. Just look at this. How does it look like? How does it look like? Yes. If you draw it together, how does it look like? So have you seen scarecrows? You know what is a scarecrow? You know what is a scarecrow? So scarecrow is the one which is kept in the farms and all. No, so this is like a scarecrow which is suspended, the head of the scarecrow, the limbs, the body, and the legs of the scarecrow. So you can remember like this. This is the order. Okay, 18 months scribbling, 2 years vertical stroke, 3 years circle, 4 years cross, 4.5 years rectangle, 5 years triangle. Okay, 5 years triangle. Clear, simple? Okay. The next thing is blocks. How do the baby arrange blocks? 18 months, the baby arranged 3 blocks. 2 years, 6 blocks. 3 years, 9 blocks. Simple. Just multiply into 3. Okay. Make this as 1. 3, 2, 3, 6, 3, 3 is 9. Okay. Fine. So what is this? 2 images. So one image is called as train. This is called as blocks in the way of train. The second image, the baby keeps another cube on top of it. So it becomes a train with chimney. Okay, so this is a train with chimney. Don't ask me where is the chimney. This is the chimney. For a 2-year-old child, this is the chimney. Okay. So train by 2 years, chimney by 2.5 years. Okay. Fine. The next thing the baby has done is, which is a, what is this? How does it look like? This looks like a bridge. Okay, this looks like a bridge. So 4 years the baby can make a bridge. 5 years a baby can make a gate. 4 years bridge, 5 years gate. Okay, fine. They can give you these images and they can ask you what is the age of the child also. Clear? Very simple. So scribbling, vertical stroke, circle, cross, rectangle, triangle. 3 blocks, 6 blocks, 9 blocks, bridge and gate. Okay, fine. Now, there was one question in UPSC. So they were asking which comes first. Just remember this order. The baby imitates first, followed by copying. So imitating is you are drawing a circle in front of the baby. The baby is imitating you and drawing a circle. That is imitating. Copying a circle is you are given an image of circle. The baby looks at that image and then copies it. That is copying. So both, if you compare, imitating will come first, followed by copying. Okay, clear? Okay, this is about fine motor. 1 or 2 fine motor milestones alone, we will just write it here. Okay. Okay, when does the baby turns page? Turning page, feeds with cup. Turning page and feeds with cup by 15 months. Okay, turning page. Feeds with spoon by 2 years. Feeds with spoon by 2 years. Okay. Okay, what is handedness? What is handedness? This was a previous year MCQ. INI-CET question. Handedness. What do you mean by handedness? See, some of you might be, yes, the preference to eat preference to use which hand. Some of you might be right-handed, some of you might be left-handed. In a child, when will you know there is handedness? Only by 3 years. Only by 3 years, the baby will start preferring a particular hand. Before 3 years, the baby will use both the hand. So you would have seen very commonly in our household, right? If a child is using the left hand for something, they will say, don't use the left hand, use the right hand. See, the child will not know that when the child is still 3 years old. Till 3 years, you can allow both the hands. Only at 3 years, the baby will prefer a particular hand. Even after 3 years, if the baby prefers left hand, it is left. Okay, you don't have to change. You don't have to change. You should be continuing the same hand which the baby prefers. Okay, so handedness is established only by 3 years. This is about fine motor. Fine motor is clear, simple. Okay. The next is language. Now we are going to see how the baby is starting to speak. How the baby is starting to speak. First is vocalization. Vocalizations is lightly the baby starts making some sounds. That is vocalization. That comes around 2 months. Next is cooing. What is cooing? Ah, ooh, ga. Like that, the baby starts making noises. That is cooing. Comes around 3 months. Laughs out loudly. Ha ha ha. The baby laughs out loudly by 4 months. Next, monosyllables. What are monosyllables? Ba, ma, da. The baby starts speaking monosyllables. That is 6 months. Just keep on adding 2 to 3 months to everything. Okay. So 6 months is ma, ba, da. Bisyllables means 2 words together. Mama, dada. This is bisyllable. When will a baby start speaking bisyllable? 9 months. Bisyllables comes by 9 months. By 1 year of age, the baby can speak 1 to 2 words, okay, with meaning, meaningful words. If the baby says amma, it means the baby is looking at the mother's face and saying amma. Baby says water, tanni, the baby wants water, ta, va. So 2 to 3 words the baby can speak with meaning by 1 year. Okay. Now, what happens after that? There is something called as jargon speech. What is jargon speech? Remember yourself in Viva. Okay, the afternoon sessions of your exams, Viva. So the examiner is asking you a question. So you will keep on telling something, but you will not know what you're trying to say. The examiner will also not know what you're trying to say. That is jargon speech. So the baby will speak on continuously, likewise. But the baby is thinking I'm telling something, but you will not be able to understand what the baby is speaking. That is called as jargon speech. Yes, jargon speech comes around 15 months. Next, 8 to 10 words with meaning by 18 months. Vocabulary increases. 18 months, the baby can speak 8 to 10 words with meaning. The vocabulary increases up to 100 words. The baby can say 2 to 3 word sentences. Baby will form sentences like ingava, come here, aduvenu. Likewise, 2 to 3 words the baby can speak as a sentence. Comes by 2 years. Comes by 2 years. Okay, 3 years the baby knows 250 words, ask questions. Okay, the baby knows its name by 3 years. Name, ask questions, very notorious age group, will keep on asking question. For everything you speak, the baby will ask question. That is 3 years old. Next, when will the baby start speaking rhymes or a poem? 4 years. That is when you send the child to LKG, right? So they will say poems, stories, rhymes and all by 4 years. Future tense, uses future tense by 5 years. See, if you speak with the 2-year-old, 3-year-old baby, for everything the baby will say nethu, nethu. Even for tomorrow, even for today, the baby uses the word nethu. Nethu means yesterday. So the baby will not know yesterday, today or future. Only by 5 years, the baby will know what is future and what is past. Okay, this is about language. Clear? Okay. Can we go to the next milestone? Social adaptive. Social adaptive. Okay. What is spontaneous smile and what is social smile? I told you about the photo shoots and all, right? There are quite a few Instagram pages who earn a lot through these newborn photo shoots. You would have seen all those, right? So they will say the newborn is smiling and they will kick you images. You would have seen these images with newborn smiling, right? So what is that smile? Why is the baby smiling? Is it of any meaning? Does the smile have any meaning? No. Social smile means looking at something and smiling is social smile in response to something. Without response, even in slide, if the baby smiles, that is called as spontaneous smile. So spontaneous smile is seen in a newborn which does not have any meaning. The baby smiles. When someone says, see, this newborn baby is smiling at me, means the baby doesn't know. Baby cannot even see who you are. The vision will be very blurry in the newborn period. So don't think the baby is looking at you and smiling. It is actually a spontaneous smile without any meaning. When will the actual smile come? Around 2 months. Around 2 months, the baby will have social smile. Social smile means the baby look at the mother's face and smile. The baby will look at the caregiver's face and smile. You speak something, the baby smiles. That is social smile, comes by 2 months. Okay. Baby recognizes mother by 3 months. Hand regard. What is hand regard? What is hand regard? See, suddenly the baby knows that, oh my God, I'm having hands. So what the baby will do, will keep on looking at his hands. Before the baby will not know he or she is having a hand. When will the baby know whether the hand is there or not? By 4 months. That is hand regard. So it will keep on looking at his hand. That is hand regard. Okay. Mirror play. So playing with the mirror by 6 months. Next is stranger anxiety. Stranger anxiety. What is stranger anxiety? When the baby sees a stranger's face, the baby will start shouting and crying. It is commonly seen in 6 months age group. So that is why when you go and play with babies in pediatric posting, no, there are some babies who will play with you nicely. There are some babies who look at you and scream as if you are one some poochandi. Why? Because around 6 months of age, stranger anxiety kicks in. So whenever you want to play, don't go and disturb the 6 months baby. Definitely it will scream at seeing your face. Okay. Next. After this comes the object permanence or constancy. What do you mean by object permanence or constancy? What do you mean by that? See, I take this pen and I'm hiding it somewhere. You all know the pen is still present. It is not disappeared, right? When will you start to know? By 9 months of age. Before 9 months of age, the baby will not know if you hide an object. But by 9 months of age, if you hide an object, the baby knows that the object is still present. That is called as object permanence. Even if you hide, the object is not disappearing. Also known as constancy. Okay, this is what we do. So older times and all. I mean, even now, the grandmothers and all, they say, right? If they want to play with a child, they say, see, kaka tukittu pochu. So the crow has taken and gone the object, and the baby will smile at it. But at 9 months of age, the baby knows that kakala tukittu pola, the object is still present. That realization is called as object permanence. Next, peekaboo. So you know how to play peekaboo? How do you play peekaboo? You close your eyes like this, open and say peekaboo. What will the baby do? The baby will start laughing. Why is the baby laughing? Is your face so funny that the baby is laughing? No, right? Then what is the reason? The baby is laughing because when you close the eyes, the baby knows that your face is behind the hand. So you're going to show up the face. So once you show up the face, the baby is laughing because of that. So that is called as playing peekaboo. So all this comes when? 9 months. Object permanence, constancy, peekaboo, 9 months of age. Waves bye-bye. When will a child say bye-bye? Again 9 months. So know this. Don't go and torture a 4-month-old baby and say bye, Sulu, bye. So it will not say bye. Only by 9 months, the baby will say bye. Okay. So before 9 months, year after, don't go and ask for bye-bye. Yes. Play simple ball game. Play simple ball game by 1 year. Okay. Next. Domestic mimicry, kisses when parents when happy, rapprochement, separation anxiety. Separation anxiety means the baby knows mother is going for work, mother is going to leave me and go. The baby sees the mother as an extended person before that. After that, the baby sees the mother as a separate person. That is separation anxiety, rapprochement and all. But what is this domestic mimicry? Domestic mimicry. I have received so many interesting responses for domestic mimicry in the previous classes and all. When I take classes for second year MBBS, third year MBBS and all. Yes, okay. Anything else? Mimic sweeping, acts like sweeping. House like okay, you people are you have completed internship, so you are fine. So I'll tell you what is that response I received. So when I asked for domestic mimicry, these people are telling, ma'am, baby mimics like domestic animals, like cats and all. That is what these people were telling. So domestic mimicry is not mimicry like domestic animals. Domestic mimicry is when the parents does an task, the baby will copy the task. If the father is sweeping, the baby will also sweep. If the mother is washing clothes, the baby will also try and do the same thing. If the mother or baby is, mother or father is washing vessels, the baby will also mimic that. That is called as domestic mimicry. When will it come, domestic mimicry? 18 months. See, all of us have done this. This is not something that is there in book that you have to mug up. All of us, you and me, when we are developing, we have done all this and developed. If you go and ask your father and mother, they will tell you all this. So at 18 months, all of us were very eager to do the domestic work. But at 18 years, we all don't want to do the domestic work. Okay. Next, undressing with support. With support, the baby will be able to undress by 2 years of age. And by 2 years, the baby can indicate toilet. If the baby wants to go to toilet, the baby can indicate toilet. Next, dressing with support. First, the baby will be able to undress. Then only the baby will come to dress. Knows name, age, gender, all this by 3 years. Colors, also colors. Add colors also. By 3 years. And by 3 years, they can also do pretend play. Okay. Plays cooperatively in a group by 4 years. 4 years goes to play school, so it will play cooperatively with other children. Dressing and undressing independently by 5 years. By 5 years, the baby can dress and undress independently. Okay, 2 important things, dry by day, dry by night. It means the baby can indicate urine in the morning, will not pass urine in the panties in the morning. Night also, baby will not soil the diapers. That is dry by day. Dry by day, 18 months. Dry by night, 2 years. Okay. Dry by day 18 months, dry by night 2 years. Okay. So this is what is the social and adaptive milestones. Okay. So other than this, you have another milestone called as razzing. What is razzing? Razzing is blowing raspberries. Boo, boo, the baby keeps on doing that. That is razzing. Comes around 5 months. Clear? So somewhat, is it easy to understand? So after this, whenever you see a baby anywhere, just observe the baby for 5 to 10 minutes. Just see what all the baby is doing. Just go and speak with them and ask, is the baby's age 2 years or 3 years based on what we have studied now. So if it is correct, you will get a lot of confidence and you will learn development much more easy way. Okay. So don't ever try to keep mnemonics. Don't ever try to mug up things. Definitely you will forget it or you will have confusion during the exam. Clear? Okay, fine. So come to vision and hearing. Vision and hearing. At birth, what will a newborn do? At birth, it can fix object and follow object till 45 degrees. Okay, fix object and follow object till 45 degrees. 4 weeks, it can follow till 90 degrees. 12 weeks, it can follow till 180 degrees. Okay, when will binocular vision come? Binocular vision means both the eyes are going to form a single image on your retina. That is binocular vision. Before that, the baby will be having double vision. Binocular vision will come by 4 months. Very important MCQ. Put a star, can be asked in exam. Binocular vision comes by 4 months. Okay. Hearing. At birth, the baby can respond to sound or react to sound. You would have seen if the baby is sleeping, suddenly you make a loud noise. The baby will do like this. What is that? Suddenly I'm tapping the table. The baby will do like this. What is that called as? Startle reflex. Very good. So the baby can respond to sound when in the newborn period. Okay, around 4 months, the baby can turn towards sound. Turn towards sound. See, I am making a sound somewhere, so it can turn towards that direction. That is called as turn towards sound. Around 10 months, the baby can have diagonal localization of sound. Diagonal localization means I am putting a sound from there. A bell sound is coming. So baby can see diagonally where is the sound coming from. That is 10 months. So many things are there. Just remember this alone in vision and hearing. That is enough. At least if you know what happens at birth. At birth, baby can fix and follow till 45 degrees. Baby can react to sound. Okay, fine. So many milestones we have seen. Okay, before we move on to the abnormalities and development, I will show you certain videos and then we'll complete development and then we'll go on to the abnormalities. Okay. Okay. So is it visible? Okay. Yes. Who is this character? Who is this character? Yes, Groot. How many Marvel fans here? Yeah, give a thumbs up. How many Marvel fans here? Yes, yes, yes. Yes, I think there are few people who still don't know like who is which is Marvel, which is DC and all, right? There are quite a few. I was one among them when I was introduced to this universe. I don't know which is Marvel. I don't know which is DC. I went to this Endgame and I was asking about where is Superman, where is Batman and all. That was my knowledge that time. And then my husband gave me a list of movies, around 30 movies. Go watch this in order. And before I went to the final. Avengers, I was able to know everyone, and my favorite character is Groot. So Groot is going to help us in learning development. So just observe what is Groot doing. This is a baby Groot. So Groot, what is the Groot doing first? The first neck control. Okay, lifting head. So around 3 months neck control. Now what is happening? Is looking at own hand. Hand regard. When does hand regard come? Yes, quickly. Hand regard. When does it come? Yes, 4 months. Very good. So now Groot is 4 months old. And Ricard, what is happening now? Now sitting with support. Okay. So sitting with support, 6 months. Now first crawling, sitting without support, then creeping. After creeping around 11 months, standing without support, trying to walk but falling. So now Groot is 1 year. So by 1 year, standing without support, trying to walk but no balance. So at 1 year, what is Groot doing? We are going to see now. So what is that one thing what is that one sentence the Groot says always? What is he saying here? Audio is not heard. Just see, everyone knows here. I am Groot. So can speak 1 to 2 word with meaning. Okay. So I am Groot. So that is the language milestone. What is this? Yes, look at this. Yes, what is this? 1 year old, what is this milestone? Very good. Mature pincer grasp. Good. Mature pincer grasp. Yes. And 1 year old, what is the social milestone? What is Groot doing? Playing simple ball game. Playing simple ball game. Okay. So this is 1 year old milestone. So 1 year old, I have given Groot. So 2 year old. Look at this baby. What is the baby doing? How is the baby climbing up? Climbing down? 2 feet per step up, 2 feet per step down. Okay. So this is 2 years old. 2 feet up, 2 feet down. Clear? Okay. For 3 year old, I will just give you a story. You remember that story, you will not forget 3 years. So 3 year old child. So just remember there is a boy whose name is Priyesh. Okay. So he is standing down. There is another girl who is in the first floor. Okay, so that girl is wearing a blue color dress. So this Priyesh is looking at that girl and he is impressed. He wants to go and impress that girl. So what he is doing, he is very excited. So what he is doing is just climbing the stairs very fast. Alternate feet up, he goes up. And then for impressing the girl, what he does it, he takes his tricycle and he is riding the tricycle around the girl in a circular way. And then he says, my name is Priyesh, what is your name? But the girl is not impressed. She didn't respond. So he's very upset and then he comes down very sad, 2 feet per step. Clear? So this is the story you have to remember. 3 years old, his name is Priyesh. He knows his name. So knows name, knows gender. Looking at a girl upstairs, knows color. The girl is wearing a blue color dress. Okay. So climbs upstairs 2 feet per step. Alternate feet per step. Very excited. Downstairs is sad. So he is climbing down 2 feet per step. Okay. And is drawing a circle around the girl and he is able to ride a tricycle. Okay. This is for 3 years old. Any doubts so far? Okay. So any other doubts you can ask at the end of the session also. Clear? Okay. So this is the development milestones. They can ask you direct milestones and ask what is the age of the child. They can give you match the following and ask which milestone comes at which age. Okay. Clear? Yes. Next, we are going to something called as development quotient. So you people would have heard about intelligent quotient. Similar to intelligent quotient, you have something called as a development quotient. So what is this development quotient? The formula is average age of attainment by actual age into 100. Very simple. You would have seen cases of developmental delay and cerebral palsy. So to know whether there is a delay or not, we are using this development quotient. For example, I will give you. There is a 2-year-old child. The child is able to sit with support. That's all. The child is not able to stand, walk or do, but the age is 2 years. Now, what is the average age of attainment? Average age of attainment is what the baby is doing right now. Sit with support. Sit with support corresponds to which age? 6 months. So 6 months is the average age of attainment. But what is the actual age of the child? 2 years. It means 24 months into 100. This is the formula. Okay, you will calculate this. This is the formula, and this is how you calculate the developmental age. For every milestone, you will calculate. For gross motor separately, fine motor separately, social separately, language separately. And then you will add everything and give the average. Okay, that is the development quotient calculation. This is the formula and interpretation. How to interpret? If development quotient is less than 70%, it means it is abnormal and you have to evaluate. Clear? That's all. Okay. 3 parameters definitions you should know. Deviance, dissociation, developmental delay. What is deviance? There is a deviation. I told you the sequence should be same. But what if there is a deviation? Acquisition of milestones in a different sequence. In a different sequence. Example, there is a spastic cerebral palsy child. Spastic CP means there is so much spasticity in the limbs. So this child, without sitting, the child can directly go stand and walk. Because of spasticity, the baby will not sit. Directly, the baby will start to walk and stand. So here what is happening? One milestone is skipped. The order is not followed. Then you will call it as deviance. Deviance in the usual order is called as deviance. What is dissociation? Dissociation means acquisition of milestones in a different rate. Acquisition of milestones in a different rate in each domain. Example, it means one domain achieves later, one domain is normal. For example, the baby is having a problem in hearing. Okay, if there is a problem in hearing, the baby cannot speak. So here the gross motor, fine motor will be absolutely normal, but there will be language delay, isolated language delay. So what is happening here? Everything is normal. One domain alone is different. So you will call it as dissociation. Dissociation. What is global developmental delay? Global developmental delay means there is a delay in more than 2 domains. Suppose gross motor is affected, fine motor is also affected, you call it as global developmental delay. Clear? Deviation means the order becomes different. The sequence is different. Dissociation means each domain will develop at different rate. Developmental delay means more than 2 domains are affected. Clear? Okay. Next, red flags in development. What does the word red flag mean? What does the word red flag mean? Where have you heard this red flag? You people, I think you people belong to Gen Z. So you use these kind of words, right? So many words which I can't understand. I belong to the 90s kids era. So this red flag, toxic, green flag, green forest. And there is another word which I don't understand, situationship. I don't know what that means. How many ever times so many people have tried to explain it to me. I don't understand what that situationship is. Yes. So similarly, red flag is such word. So whenever you use this word red flag, when you see a toxic relationship, you say, no, she's a red flag. Don't be with her, right? So I've heard this term so many times, red flag. When someone is so nice, you call them as a green flag, even green forest. Virat Kohli became green forest during that World Cup season. Just because she responded to Anushka, he responded to Anushka, he became the green forest during that season, right? So red flag means what? Something abnormal, that's all. Danger. Okay, danger. So I told you so many milestones and so many age groups at which it is attained normally. What is the danger sign there? Beyond which, if the milestone is not attained, you will call it as abnormal, is called as red flags. Few red flags alone we will see. No visual fixation. At birth itself, the baby should have visual fixation. No visual fixation even after 2 months is a red flag. No vocalization even after 6 months is a red flag. Not sitting with support even after 10 months is a red flag. Not standing alone even after 17 months is a red flag. Not walking alone by 18 months. No single words. The baby is not speaking even a single word by 18 months is a red flag. So just copy this down. Okay, you just have to mug up this. Okay, and one more thing, loss of comprehension at any age is a red flag. Loss of comprehension at any age is a red flag. Fine. These are red flags. If you remember this, that is enough, because these have been asked in UPSC exams. So far, not asked in NEET-PG, but this UPSC paper, it happens to be quite difficult compared to NEET-PG. Okay, so this was asked in UPSC exams. Right? Clear with this? Okay, can we move on to the next one? The next one we are going to see is the behavioral disorders. Very simple, very only 2 to 3 words we are going to see in this. Okay, so this is integrated with psychiatry as well. Psychiatry will also teach you about, ma'am will also teach you about the ASD, this ADHD and all. So in the pediatric point of view, I'm going to teach what this disorder, how to identify this disorder, what to do. That's all. Okay, so autism. What is autism? Autism means, yes, impaired social interaction, impaired communication, stereotypical behavior. Three things. Baby who is not socially interactive. The baby who does not verbally communicate. The baby who is having a stereotype behavior. Stereotype behavior means they will have interest in certain things. Suppose a baby likes trains. The only toy the baby will get is train. It will keep on buying trains and it will keep on playing with trains. If the baby wants to draw something, then also he will draw train. If he wants to see something, then also he will insist for train. That is called a stereotypical behavior or a interest which is pointed to a particular thing. Okay. So when you see a child who is not interacting, who is not maintaining eye contact, who is having a stereotypical behavior, he or she belongs to autism. Okay, autism. So autism is not a disease. It is not a disease. You see so many people who are functioning with autism. To be frank, there are so many personalities who are famous, who are businessmen who have autism. Abdul Kalam had autism. Elon Musk, you all know who is Elon Musk. Elon Musk has a type of autism, and you would have seen a series called as Good Doctor. Have you seen the series Good Doctor? There's a person called as Sean Murphy who is playing in Good Doctor. Yes, he also has a type of autism called as savant syndrome. These autism people, they have problem with behavior, problem with interaction. That doesn't mean they have intellectual disability or they cannot perform well. They are highly functional in certain interests. They will have a particular interest. If you tune them in that interest, they will be able to highly perform. But social interaction becomes a difficulty for these people. Clear? So autism spectrum disorder is associated with conditions like Fragile X syndrome, tuberous sclerosis, Angelman syndrome. These are some associations. Treatment of autism is behavioral therapy. The onset is important. Onset is within 3 years. Nowadays, you see, autism is very, very on the higher side. Can anyone tell me what could be the reason for that? See, just you go to a restaurant or you go to a mall, you would have seen so many children. How many children interact with you? So many children, they are into their own world. They don't interact with other people. They don't interact with the surrounding. What is the reason? Less spacing, very good. Next one, screen time, very important. Screen time. There is an increase in screen time. Their only world is the screen. If you give a tab, if you give a mobile, they're occupied with it. They don't want to interact. They don't want to have interpersonal relationships and all. So the screen time is the only important factor for nowadays. You see so many behavioral abnormalities and autism. So what is, even in screen time, see, I'm not speaking which is not necessary. It can also come as an MCQ. Okay. Screen time. Can we give screen time to children? No. Less than 2 years. No screen time. No, nil. Not even 5 minutes of rhymes, cartoons, no screen time less than 2 years. More than 2 years, 1 hour per day is the maximum, which includes everything, be it mobile, be it TV, tab, anything. Okay, 1 hour per day maximum. Okay, very important screen time. Okay, next coming to ADHD. See, ADHD is the other end of the spectrum. In autism, if you see a child who is not responding, not doesn't want to interact, ADHD is the one who is causing a lot of trouble. You would have seen in functions or any festivals and all. There will be a group of children chumma running here and there. They will not sit at one place. You don't know what is the problem, but they will keep on running. That is ADHD. So ADHD, 3 parameters will be there. Inattention, attention dissipated. So inattention, hyperactivity. Yes. What is the one more thing? Impulsivity. They will have impulsive behavior. These are the 3 parameters of ADHD. ADHD is the most common neurobehavioral disorder in children. Okay, most common neurobehavioral disorder in children. Here the onset can be anywhere within 12 years. Onset is within 12 years. Okay. So for ADHD, you have so many treatments, so many drugs. I will just list out 2 drugs, atomoxetine, methylphenidate. These are some of the drugs that can be used in ADHD. Okay. The next one is specific learning disability. 3 specific learning disabilities are there. Dyslexia, dysgraphia, dyscalculia. Have you seen this film Tare Zameen Par? Tare Zameen Par. Wonderful film. Yeah, wonderful film. What is the child having in that? Child is having dyslexia. So dyslexia is difficulty in reading. Okay. So this 3 and all will be like ulta 3, A will be ulta and also they have difficulty in reading. So that is dyslexia. Dysgraphia, difficulty in writing. Dyscalculia is what we have, doctors. Difficulty in simple calculations. Okay. So 3 specific learning disabilities. Again, previously asked UPSC question. Dyslexia, dysgraphia, dyscalculia. Okay. Next behavioral abnormality is thumb sucking. Thumb sucking. So many children would have seen comfort sucking. So it is normal in infants. Definitely, if you see a baby who's less than 1 year, the baby will be keeping the thumb in the mouth. So what will people do? Don't do that. Don't do that. Why is the baby doing that? Because of comfort. The baby finds comfort in anxious situations. That is why the baby is thumb sucking. It is normal in infants. Please don't pull out their thumb. Okay, it is normal in infants. After 4 years, if it is persistent, it can cause dental malocclusion. Okay, dental malocclusion is possible after 4 years if it is persistent. Before that, don't do anything. Okay. After 2 years, usually most of the children will stop thumb sucking. Yes. What is pica? Pica. Have you heard of this pica? Yes, pica. Ingestion of non-nutritive substances. Ingestion of non-nutritive substances persistent for more than 1 month, which is developmentally inappropriate. As I told you, this is also very normal in a very small child. 2-year child and all, pica is normal because they will have that urge to put everything in the mouth. That is called as mouthing. That is also developmental, comes around 5 months of age. Whatever you give, the baby will put it in the mouth. That is mouthing. So developmentally inappropriate means more than 5 years. If the child is having pica, it is abnormal for a persistence of more than 1 month. What are the common substances that they can ingest? Common substances that they can ingest: clay, sand, paint. All this is common. Okay, what can happen? Complications because of this. Complications? Yeah, chalk is also possible. Yes. Worm infestations because of eating all this. Because of worm infestations, they can have iron deficiency, anemia. They can also have lead poisoning. Why lead poisoning? Why lead poisoning? Because of paint. Yes. How to treat them? Give them behavioral therapy, deworming, iron supplementation. Deworming and iron supplements. So that is pica. More than 1 month, if it is persistent only, you can call it as pica. Okay. Temper tantrums. What is this temper tantrums? Definitely all of you here would have seen this temper tantrum. If you go to any mall, okay, be it Phoenix or whatever mall is there in your city, there is a showroom called as Hamleys. Hamleys is a showroom which will have all these toys and all. Even if we go inside, we will feel like buying something from Hamleys. So in front of Hamleys, there will be a man who is blowing the bubbles and all. And definitely you can see one kid who is rolling on the floor in front of Hamleys and shouting and crying. Very common situation. Seen? Yes. What is this? That is nothing but temper tantrum. Temper tantrum is very common in toddlers. It peaks around 18 months to 36 months. Okay, 18 months to 36 months, this temper tantrum peaks. This is an attention-seeking behavior. Okay, to draw attention, they are doing all this. What all they will do? They will throw the items. They will cry, continuously cry. They will bang their head, rolling on the floor. All these are temper tantrums. What to do for this temper tantrum? What to do? First thing is, do not yield into this behavior. Suppose the child is crying the top, okay, for the toy. Okay, just because you feel embarrassed in front of everyone and you want to make your child stop, you go and buy the thing and give it to a child. The child will think that if I cry, I will get everything. So this behavior will keep on continuing. So you should never yield in. You should just distract them. So distraction and timeout techniques are helpful. You should never yield into this behavior. That is temper tantrum. Okay. The next one is called as breath holding spells. What is breath holding spell? Breath holding spell is the baby starts crying. At the end of crying, the baby will stop breathing and the baby will start feeling pale and cyanotic. That is breath holding spell. So this happens when there is frustration or anger. So when the baby is frustrated or angry, the baby starts crying. So baby continues to cry, stops at full respiration. Then the baby can become either pale or cyanotic. So you have two types of breath holding spell: pallid spell, cyanotic spell. Differential diagnosis, sometimes it can look like seizures because it is very worrisome, right? You see a child who is crying and then suddenly stops breathing, not moving his or her limb. So differential diagnosis are seizures, arrhythmia. Okay, these are differential diagnosis. How to treat? Do not lift the child. When the child is having a breath holding spell, do not lift the child, because what you will do if you lift the child, you are decreasing the venous return to the brain. I mean, you are decreasing the venous return and you are decreasing the blood supply to the brain. So do not lift the child. Okay. Then what will you do? Iron supplementation, positioning to prevent aspiration. That is enough. Okay, you position the child, take the child to hospital. Sometimes they say iron supplementation helps in breath holding spell. That is breath holding spell. What is the next thing? The next thing is called as a tick disorder. Tics are, it can be motor tics or it can be vocal tics, sudden jerky movements like this. That is called as tick disorder. Okay. Sudden jerky movements will be there. That is called as tick disorder. You have two types of tics, motor tics and vocal tics. Okay, common motor things are blinking. You would have seen so many people. They will keep on blinking. That is one motor tic. Next is shrugging shoulders. Shrugging. Shrugging shoulders and neck jerking like this. Like this. That is neck jerking. All this will come under simple motor tics. Okay. So come to complex motor tics, you have two things. They are called as echopraxia, copropraxia. Echopraxia, copropraxia. Echopraxia is imitating a behavior. If someone is doing something, you imitate that. Imitates activities is called as echopraxia. Copropraxia is doing obscene gestures. Obscene gesture is called as copropraxia. Okay. Now coming to vocal tics. So coming to vocal tics. So in vocal tics, you will have these kind of tics like where they will see this vocalization. They will have the sniffing movements like this sniffing. Okay, vocal tics. That is vocal tics. Okay, in complex vocal tics, you have echolalia, coprolalia, pachylalia. Echolalia, coprolalia, pachylalia. Echolalia means same, imitating. Okay, so imitating. How do they imitate? If someone is speaking, they will repeat the word. Okay, they will repeat the word, imitate the word or repeat the word. Coprolalia is they will use obscene words. Pachylalia is they will repeat their own words. They will keep on telling the same word again. Okay, this is about tics. So tics means, echo means imitating, copro means obscene, which is not acceptable. Pachy means repeating their own behavior or own words. Okay, so that is tic disorder. Next, under tics, you have a syndrome called as Tourette syndrome. It's called as Tourette syndrome. So Tourette syndrome, the onset can be anywhere less than 18 years. They will have both motor tics and vocal tics. Both should be there. Okay, both should be there. And waxing and waning phenomenon. Suddenly the tics will increase, suddenly the tics will decrease. Waxing and waning phases. It should persist for more than 1 year. Very important, Tourette syndrome. Questions have been asked previously from Tourette syndrome. So Tourette syndrome means below 18 years who's having both motor and vocal tics, waxing and waning phases, persisting for more than 1 year. Okay. Yes. What is bruxism? Bruxism. Teeth grinding. Teeth grinding is bruxism. Because of bruxism, you can have dental malocclusion and you can have TM joint. Okay. So, encoparesis is passage of stool in clothes, involuntary, more than 4 years of age. Okay. So, encoparesis, you have two types of encoparesis. Retentive encoparesis, non-retentive encoparesis. Retentive encoparesis means there is a constipation. Because of constipation, because of retention, finally it is going for encoparesis. This is seen in case of constipation. Very common in children. Very common in children. Retentive encoparesis. Non-retentive encoparesis is absence of constipation. There is some other organic problem that is called as non-retentive encoparesis. Okay. Next, enuresis. Nocturnal enuresis is what? Involuntary passage of urine. Involuntary passage of urine in a child who is more than 5 years old. By 5 years old, they should not pass urine in the night. Okay. So I told you 2 years is when they become dry by night. But some children, they will take 3 years, 4 years, 5 years. But the cutoff is 5 years. After 5 years, if they are passing urine in the bed, you call it as nocturnal enuresis. This nocturnal enuresis can be primary or can be secondary. Primary means from birth till now, they have not been dry in the night. It means they have not attained bladder control. That is primary. Secondary means they are having enuresis after achieving bladder control for 6 months. 6 months they have been normal. At least more than 6 months they have been not passing urine in their bed. But after achieving bed control, they are passing urine means it will come under secondary enuresis. Okay, this is nocturnal enuresis. So when a child comes with nocturnal enuresis, the treatment is very important. Okay, the first thing you are going to do is motivational therapy. You are not supposed to scold them. You're not supposed to give negative punishments and all. Motivational, you motivate them. If they don't pass urine in the night in the bed, you motivate them. You give them positive reinforcement. If the child is not responding to that, you will go to next therapy called as alarm therapy. What is alarm therapy? Bell and pad based conditioning. So alarm therapy is where you will have an bell and a pad. The pad is kept over the underwear of the child. When the child is sleeping, suppose the child passes urine, immediately the pad will sense that urine and a bell will ring. Once the alarm rings, the child has to wake up, go to the restroom and void the urine and come. This is alarm therapy, which is done next. If the child does not respond to alarm therapy also, then only you will go to drugs. Drugs that can be used are oxybutynin, tolterodine, desmopressin. Oxybutynin, tolterodine, desmopressin. These drugs can be used. Imipramine not advised in children. The recent edition of OPGAI says this. If you have followed the previous edition of OPGAI, imipramine was there in the treatment. But the recent edition says imipramine should not be used. And bladder training is of no use. Bladder training is of no use. Two things you should know. There's no use in doing bladder training. There's no use in giving imipramine. Imipramine has so many adverse effects. Okay. So the last thing we are going to see in this chapter is called as Rett syndrome. I have already told you one point about Rett syndrome. What was that point? One point I told you in Rett syndrome. Acquired cause of what? Microcephaly. Very good. So Rett syndrome, very important. It is an X X-linked dominant disorder. Only few X-linked dominant disorders are there. When I'm teaching you genetics, I will teach you in detail about all that. But as and when I tell you the inheritance patterns, please keep that in mind. Okay. So this is due to a mutation in a gene called as MECP2. Very important, MECP2. Okay. Here you will have neuroregression. Neuroregression, acquired microcephaly, seizures. Okay. So, what is neurodepression? What do you mean by the word neuroregression? See, developmental delay means from birth there is a delay in acquiring milestone. That is developmental delay. Neuroregression means they have been normal till one point of time. After which, what is happening? They are losing the milestones. For example, till 1 year the child was normal. The child was able to stand, but slowly the child is not able to stand. Slowly the child is not able to sit. Now the child is bedridden. That is regression. Okay, losing the milestones is called as regression. So this will come under Rett syndrome. There was a recent drug which was introduced or approved for Rett syndrome called as prophenatide. Prophenatide. INI-CET may question. Prophenatide is a drug used for DASH. It is used for Rett syndrome. INI-CET question. Okay, MECP2. Yes, MECP2 is the mutation which causes Rett syndrome. Okay, so that gene is defective in Rett syndrome. Okay, so we have come to the end of development. So where we started with development milestones, domains of development, in individual milestones, and what is developmental delay, development quotient. Then we came to certain disorders, so many developmental disorders. Autism spectrum is where the child is not maintaining eye contact, social interaction is not there. ADHD, where there is inattention, hyperactivity, impulsivity. Specific learning disorders, 3 disorders: dyslexia, dysgraphia, dyscalculia. Thumb sucking, normal in infants. Pica, you all know, ingestion of non-nutritive substances. Temper tantrum is what you see outside the toy stores and all. Breath holding spell, 2 types: palate spell, cyanotic spell. Tic disorders, motor tics are there, vocal tics are there. One type of tic disorder is called as Tourette syndrome. Bruxism is teeth grinding. Encoparesis is passage of stool in a child who is more than 4 years. Nocturnal enuresis is passage of urine in a child more than 5 years. Okay, Rett syndrome is a X-linked dominant disorder. Okay, fine.